These days, modern medicine offers many tests to help catch disease early. But not every test is safe for older adults. In fact, some very common tests may bring unexpected risks to your heart, brain, or kidneys if you're not careful or don't ask the right questions first. There have been cases where, after just one CT scan or a sedated endoscopy, patients experienced sudden drops in blood pressure, dizziness, temporary memory loss, even a minor stroke. The truth is, many of these risks can be avoided. How? Simply by asking your doctor a few key questions before agreeing to the test. So in today's video, Senior Health Every Day will walk you through 7 common tests older adults should think twice about. Each one includes practical advice from doctors to help you and your loved ones stay safe. 1. CT scan with contrast dye. Think twice if you have heart or kidney issues. Your doctor may recommend a CT scan with contrast dye to get clearer images. But if you're over 60, and especially if you have heart disease, high blood pressure, or kidney problems, listen closely before saying yes. Contrast dye isn't as harmless as it sounds. In sensitive people, it can trigger a sudden drop in blood pressure because of a vagal reflex. In others, it may cause blood vessels to tighten, raising blood pressure sharply. The result? Less blood flow to the brain, and that can be dangerous. Studies show that older adults with chronic conditions are much more likely to experience blood vessel complications within 72 hours after a contrast-enhanced CT. That's why I always recommend 2 simple but important steps. Ask your doctor, is it possible to do this CT without contrast dye? Sometimes a safer alternative is available. Always get a kidney function test before the scan, especially if you've had kidney issues or diabetes. You deserve to fully understand your options. Don't be afraid to ask questions. Because sometimes one small 2 stress test, not everyone should be running on that treadmill. Has your doctor ever suggested a stress test, where you walk or run on a treadmill while your heart is monitored? Sounds simple. But for people over 65, especially those with heart issues, this sudden exertion can be risky. I've seen patients experience sudden spikes in blood pressure during the test, irregular heart rhythms, dizziness, shortness of breath, even small brain bleeds from overexertion. Clinical studies show that nearly 7% of people over 65 experience complications during or right after a traditional stress test. But here's the good news. You don't always have to run to get a clear picture of your heart. Ask about a medication-based stress test called a nuclear stress test. This simulates exercise using medicine without the strain. Or try a resting echocardiogram, a relaxed ultrasound of your heart. Most importantly, ask your doctor, do I have any symptoms? If not, do I really need this test right now? More tests don't always mean better care. Smart choices start with the right question. 3. Sedated endoscopy. Know the risks to your brain and blood pressure. Endoscopy is a common procedure to look inside the stomach or colon. But when it involves full sedation, it's not so simple, especially for anyone over 65. Many folks think, I'll just sleep through it, it'll be easier. But sedation can carry real risks. It can cause a sudden drop in blood pressure, reducing blood flow to the brain. If you're on blood thinners, it increases the chance of internal or brain bleeding. A 2021 study found that the risk of a temporary brain event, TIA, goes up significantly in older adults within 72 hours of a sedated endoscopy. So before you agree to sedation, here are 3 things to do. Ask clearly, is this endoscopy truly necessary or are there safer ways to monitor? Tell your doctor about all medications, especially blood thinners, aspirin, or heart meds. If your health allows, ask for the non-sedated version or just light sedate. We're not afraid of endoscopy. We just need to be smart about when to. For MRI with gadolinium contrast, be careful if you have kidney problems. MRI is an excellent tool to look inside the body, especially the brain and soft tissues. But if your doctor suggests one with gadolinium contrast, seniors with kidney issues need to be extra cautious. Why? Gadolinium makes MRI images clearer, but it's filtered through your kidneys. And if your kidneys aren't working well, it can build up in your body and cause trouble. Some patients feel confused, dizzy, or disoriented afterward. In rare cases, it causes a serious condition called NSF, where skin and muscles harden. Studies report that up to 5% of seniors show stroke-like symptoms after MRI with contrast. So before agreeing to a contrast MRI, remember these 2 safety steps. Ask your doctor, can we do this MRI without the contrast dye? Always request a kidney function test first, GFR or creatinine. If the numbers are low, it's best to skip the gadolinium. Medical technology is powerful, but you still get to decide what's safest for you. 5. Carotid ultrasound. Don't rush into surgery without symptoms. Have you had an ultrasound of the arteries in your neck? It checks for blockages in the carotid arteries, important vessels that bring blood to your brain. But here's what many people don't know. Just because an artery looks narrow doesn't always mean you need surgery. Many patients are told they have 50–60% narrowing, but have no symptoms. And yet they're referred for surgery, even though it may not be necessary. Long-term studies show, for people with no symptoms, medication plus lifestyle changes work just as well as surgery, and with far less risk. So if your doctor suggests surgery after a carotid ultrasound, slow down and ask, if my artery is narrowed, what's the next step? And can I get a second opinion before making a decision? Sometimes doing nothing is the safest choice, as long as you're being monitored and managed carefully. 6. PET scan, not always needed for cancer screening. PET scans are high-tech tools to detect cancer, but they're not for everyone and not always the best idea, especially if you have no symptoms. Did you know? PET scans use small amounts of radioactive material to scan the body. In older adults, unnecessary scans can lead to anxiety from unclear or false positive results, misdiagnosis, like mistaking a benign lump for cancer, unneeded biopsies, treatments, or procedures with real risks. Studies show, for seniors with no signs of cancer, routine PET scans don't improve survival. They may even increase the chance of harm from unnecessary treatments. Smart steps to take? Ask, do I really need this PET scan right now? If you're symptom-free and it's just routine, think twice. Avoid the cycle of test, biopsy, treatment when it might not be needed. Smart healthcare is safe. 7. Routine chest X-rays. Watch out for unclear shadows. Many older adults get yearly chest X-rays, hoping to catch lung cancer early. But the truth is, routine X-rays aren't always necessary, and sometimes create more worry than help. A small shadow on the film could be a harmless scar, calcium deposit, or even a bad angle. But it may be mistaken for cancer. That leads to repeat scans, painful biopsies, and sometimes full treatment cycles that weren't needed at all. Research shows 60% of suspicious findings on routine X-rays aren't cancer, yet still result in unnecessary procedures. That's why doctors recommend only get chest X-rays if you have symptoms like long-term cough, trouble breathing, or unexplained chest pain. And always ask, what's the real benefit of doing this? Dear friend, as medical technology advances, so should our awareness and decision-making. Not every test is right for every person. Not every doctor's suggestion fits your age or health status. Be the one who asks questions. Be the one who learns and chooses wisely. Because every test should protect you, not put you at risk. If you found this video helpful, please share it with your family and friends. And don't forget to subscribe to Senior Health every day. Every week we'll bring you simple, practical, and heartfelt advice made just for you. See you in the next video.